researching transport inequalities in global South cities, where we are opening spaces every 2 weeks to discuss around different topics surrounding these issues of transport and mobilities in cities of the global South. We already had 2 sessions. The first one focused on access to opportunities. The second one focused on informality, and you can find the links to the recordings in the Interlink website. And today we're going to be discussing transitions to sustainable urban mobility. So my name is Danil Oviedo. I am a lecturer at the Development Planning Unit of University College London, and I'm stepping in for one of my co-conveners, Dr. Rafa Pereira from IPEA in Brazil, who couldn't join us today because he had a last-minute emergency. And the other person organizing the workshop is Professor Karen Lucas, who is there waving very friendly, and the director of the Interlink network, which is the International Network for Transport and Accessibility in Low-Income Communities. So without further ado, today we're going to start our sessions on transitions. Joining us, we have Professor James Evans from the University of Manchester, Dr. Clemence Cavoli, who is a research associate at the Center for Transport Studies in University College London, and Dr. Lynn Scholl, who is a senior transport specialist at the Inter-American Development Bank. So we have 3 15-minute presentations. We're going to have a very strict control of time, and we're going to start with James. So all yours.
Thank you very much, Daniel. I will just try and share my screen and tell you who I am while I do that. Is that working, Daniel?
Yes, we're seeing your screen.
Brilliant, lovely. So my name's James Evans. I'm based at the University of Manchester in the Department of Geography. I'm also a part of the Manchester Urban Institute, where I lead the work on smart and sustainable cities. And my approach to mobility and transport is very much coming from the perspective of urban governance. So how cities are governed, who's them, what they're trying to achieve, and how they do that. So this topic today of transitions to sustainable mobility, post-COVID transitions, is something quite close to my heart. I'm going to give quite a broad presentation that, if anything, is more designed to provoke some topics for discussion. I very much like to hear what the other panelists and indeed the attendees are thinking about the ways in which cities can change to address the challenges facing them through this. And I'm guessing that's why I've been put first as well, because it's a bit more of an overview presentation. So just to set out some of the context, clearly we've seen a whole series of quite profound impacts created by COVID on mobility. Google and Apple data that's been released in the last couple of months suggests 90% reduced mobility compared to usual patterns. At the same time, we've seen spikes in things like bike use, massive drop-offs in motorized traffic, especially in major cities, associated improvements in air quality, but at the same time, major social and economic damage created by the shutdown of business, the decrease in consumption, closures of schools, limited access to a whole range of services for a whole range of populations, and the loss of livelihoods, either directly in transport or due to the lack of mobility. And this has generated a whole series of long-term impacts on urban mobility, about which there's lots of speculation, but at this point in time, it's not clear which direction things are going to go in. Along with a colleague called Joe Rivets, we've been thinking about different scenarios for cities, and this is not just relating to mobility and transport. This is thinking through where cities are going to go from here. What we have seen is the kind of lockdown city, essentially where people are, if they go out, it's essentially in privately owned cars. And there's potentially a lot more surveillance in the form of CCTV, potentially cameras that can check people's body temperatures, track and trace apps in various levels of compulsory use. There's the business as usual city. Will cities simply bounce back to where they were pre-COVID? That kind of model of unsustainable levels of consumption and resource use? Will we see elements of the virtual city persevere after COVID? The Zoomiversity, us all sat at home staring at screens, the potential death of the public sphere. Or, of course, there's what lots of people are talking about at the moment, which is, can we use this crisis to accelerate a transition towards the sustainable city? And this seems, in Europe at least, and North America, people have been talking about this as a clean recovery. So is there the potential to recover from COVID back to a new normal, which is somehow cleaner and greener? In terms of transport, that means more active transport, less private cars, more accessible services, more inclusive neighborhoods, and so on. The way this has landed in cities, I mean, this is the bit I'm really interested in. So lots of people have become interested in cities in the last decade, but I'm really interested in how this translates into change on the ground. There's an awful lot of talk about what cities could do, what cities should do. If you actually work with cities, you realize they're a kind of bunch of often large but poorly funded organizations with lots of core functions to deliver that they struggle to deliver, not much capacity to even deliver core services, let alone manage change or do new things. And this is why I really, I started off as a sustainability researcher. This is why I've become more and more interested in cities, because unless you can implement change, you can have the best ideas and the best will in the world, but it's not going to be made, it's not going to turn into reality. So cities are absolutely key to delivering these changes. If we want a clean recovery, if we want more active transport, if we want to prevent a mass uptake of the private car, cities are the places that are going to have to do this for us. But it's not a great time for them to have to do this. They're taking a massive hit to their revenue from business rates, from public transport operations, from rents, and increasingly having to spend more and more on social care, food parcels. So cities are in a bad state from a financial point of view. And similarly, they're facing something of an existential threat. So the problem with infectious diseases is that they travel most effectively where people are crowded together. And cities, by definition, bring people together. And some of the most successful cities in the world are defined by high densities. So are we seeing the death of density? I was looking at some modeling by some North American economists, which was showing there was a direct correlation between urban density and the rates of COVID transmission. So this is a serious challenge for cities more generally. So what have we seen so far in terms of a response from cities? We've seen effectively a form of crisis urbanism, similar to how cities have responded to things like earthquakes, hurricanes, flooding in the past. Obviously, this is a bit different because rather than just one or two cities in a specific part of the world being hit by a crisis, every city has been hit by this crisis at once. But you're seeing rapid, reactive attempts to respond to some of the challenges that COVID has created. In terms of transport, what does that look like? Probably most visibly, it looks like pop-up infrastructure. temporary bike lanes, temporary restrictions on traffic in the middle of cities like Paris. Lying behind that, I think COVID has also created a kind of rapid response of community and neighborhood self-organization. So from a governance perspective, this is interesting. A lot of the social response around taking care of, I don't know, elderly residents, delivering food parcels, this kind of thing, has seen rapid and really well-organized community organizations emerge to do this. They haven't yet migrated into the sphere of active travel, I wouldn't say, but from an urban governance point of view, this has been a notable development as a result of COVID. And then, of course, you've also seen the emergence of new models for what a city could and should look like after COVID. One of the best known models is the Paris idea of the 15-minute city, where no essential services should be more than a 15-minute walk away. Reminiscent of the Dutch Woonurth model, which is neighborhoods designed around where you can get on a bike, so making sure you can access services on a bike. Ideas of quality catchments, similarly walkable neighborhoods where you can walk to all the services you need rather than having to even set foot on a bus or think about buying a car. But what we've seen really is, on one level, yes, there's been a whole load of experiments going on in cities trying out new things quite rapidly, not necessarily with a large evidence base, short-circuiting standard kind of planning cycles where you have to write policy, consult around the policy, translate it into plans, get those plans funded, turn them into implementation plans. You know, those kind of standard cycles of cities can take 3 to 10 years. We've seen them completely bypassed by a lot of these pop-up kind of responses. But they're highly divergent. So some cities have been very good at this and been really nimble. Other cities have done almost nothing. So as with a lot of these things around the COVID crisis, you're seeing pre-existing inequalities massively magnified. The cities that can are really forging ahead, but there's a lot of cities that aren't really doing anything. You're also seeing a complete lack of coordination between cities as yet. There doesn't seem to have been much learning from each other or much discussion about what could be done, especially around transport yet. And I guess that leads to the final point on here, which is who's actually monitoring or evaluating the impacts of some of these pop-up infrastructures and new models. And that kind of ties in with the coordination. And that, of course, starts to tie in with the divergent actions. That's how you can encourage some of the cities that aren't taking these steps to consider doing so. Beyond the bubble of the global north, it's worth thinking about what this looks like in other parts of the world. We've got a project currently with Walk 21 and UNEP in Nairobi looking at whether African cities are taking action around walking and improving walking conditions in the aftermath of COVID. Very different situation in Africa, by and large, fairly huge and rapidly growing urban populations. Africa's where most of the urban growth in the rest of this century is going to take place, but very high existing shares of active transport, not cycling, mostly walking. So for example, almost 3/4 of all trips in Senegal are made by walking. So here it's a bit of a different challenge. It's more about mode retention, so making sure people keep walking, making walking more attractive, maybe planning for walking. So that 70% of trips in Senegal made by walking is impressive, especially when you consider there's no policies for walking or walkability in Senegal at all. The challenges are also a bit different though. The World Health Organization has a much smaller footprint in Africa. COVID is simply further down the list of threats in Africa. A number of countries still managing Ebola. East Africa's been suffering from a plague of locusts. There's also a very different regulatory context. So the picture to the right is taken from Lagos a couple of months before lockdown, when the Lagos Metropolitan Transport Authority banned motorcycles. And this was how a lot of people got around the city on motorcycle taxis. And as you can see, overnight, it transformed it into a walking city. So you're looking at a situation where the regulatory context can change quite quickly, but equally, you're potentially dealing with large populations of walkers who can be retained post-COVID. So I guess these are my thoughts on what a long-term response in terms of post-COVID mobility needs to look like from a city's point of view. I think critically, cities are going to need to become much better at learning what's worked from each other. Quite a lot of these rapid responses need to be monitored in some kind of effective way, or evaluated in some kind of effective way, to understand what works and what doesn't. And this is critical in terms of that fork in the road between a clean recovery and a dirty recovery. The more evidence cities can get about what works and how you encourage walking and cycling, and the benefits of that, the more easy it's going to be to do more of that in the future and deprioritize the car. Clearly, universities and researchers have a big potential role to play there. That's what we do. In some ways, we understand whether something is beneficial or not to society. So there's a big role for us to play there. And there's also a big role in facilitating that learning between cities, because at the moment, in terms of international learning, beyond C40, ICLEI, and a handful of other networks, there's surprisingly little well-structured discourse between cities. The second thing is we need more coherent visions of what we want all this to look like after COVID. And this is undoubtedly something that it's too early to do yet, but over the next, I would say, 24 months, it's important that cities come up with coherent visions for what kind of transport systems they want, what kind of lifestyles and livelihoods they want in their cities. Again, because that will then shape what becomes possible and what becomes less possible. At the moment, what I see from most of the cities I've engaged with is a kind of sleepwalking towards a car future. The final thing I think is worthy of attention is much better understanding of how cities are able to make change, so the capability different cities have to make change. So one example here from the UK, London's already developed a rapid response walking plan for post-COVID and is already putting it into place in the city. And a lot of the reason they've been able to do that so quickly is because they have a track record of responding to major events and implementing large-scale temporary transport interventions related to the London Olympics. So they have a track record of doing this. They've got people in place who have the knowledge of how to do it. They've got the confidence that it can be done. So track record in different cities is extremely important, and different cities have very different experiences and capabilities there. Another critical thing is coordination within the different organizations that make up a city and its governance ecosystem. So I'm using the word cities here as a shorthand for the whole range of organizations that come together to govern cities. So clearly, municipal bodies and transport authorities are going to have to start operating in more joined up ways if we're going to see a clean recovery and not Carmageddon. But they're going to have to go beyond that. They're going to have to understand how to deliver health outcomes and how to work more closely with different health authorities. And this isn't just health services, hospitals, it's public health bodies. It's also health and safety bodies. So I think those connections between health, the urban environment, and things that happen in the urban environment, like transport, have been highlighted massively by the COVID crisis. And the cities that are going to respond most effectively to that are the ones that have those well-networked organizations across the municipality, transport, and health. And that, again, is something that as researchers, transport scholars, urban scholars, I feel we need to know more about. Thank you.
Thank you, James. And here is a final slide with the link to James's book. We're going to also paste it in the chat for everyone that wants to explore it. Now I'd like to give segue to Clemence Cavoli, who's going to speak about transition to sustainable urban mobility in Africa.
Hi, thank you, Danil. I think I need James to stop sharing his screen so that I can...
Yeah, sorry, I'm trying to... Nope. Has it gone away now?
Well, now we seem, no, I don't think so. I think what we have is your main screen. I think you just need to unshare. You have to.
Yeah, I'm trying to get the main Zoom window.
Clemence, can you start trying sharing? I think you can override James now.
Meeting controls, this looks promising. No, the meeting controls have disappeared at the top of the screen.
At the bottom?
At the bottom.
I think actually, Clemence, if you click on your shared screen, it should work.
No, unfortunately, it says it. Oh, yes. Actually, no.
At the bottom. This will
Does it
stop
work?
others sharing.
Oh, here we go.
It's working now.
Got it. Great.
Brilliant. Thanks, Danil. Thanks, James, for this great presentation. So I'm really thrilled to be given the opportunity to share some of the key findings from our TSUM project, Transitions to Sustainable Mobility and Land Use in Sub-Saharan African Cities. So this is a project funded by the UK Research Councils and GCRF. The aim of the project is to identify the conditions under which pathways to sustainable and inclusive transport and land use development can be accelerated in growing cities in the global south. We're working with two fascinating cities in sub-Saharan Africa, Freetown and in Sierra Leone and Mozambique, and Maputo in Mozambique. And I'd like to invite you to travel to these cities for a little while with me. So Maputo, we're talking about a city of circa 1 million inhabitants. With the metropolitan area, we're over 2 million inhabitants. It's a coastal city and it's a relatively flat city. Freetown in Sierra Leone has a similar population. The metropolitan area is closer to 1.5 million. It's also a coastal city, but it's a hilly city. But before I tell you a little bit more about what we have been doing in these two cities, and what results we're generating, I'd like to tell you a bit about the framework, the conceptual framework. So when we talk about transition, urban mobility transition, in the context of the TSUM project, what do we mean exactly? And the best way to describe what we mean by transition is by using this, this diagram. So this diagram illustrates different cities. The dots represent different cities. The vertical axis represents the percentage of private motorized modal share. The horizontal axis represents GDP per capita. Disclaimer, this is actually data, it's from UATP and it's from 1995, but this is highly relevant, and I'll explain in a second why. So the fascinating thing about this diagram is that there seems to be 3 different clusters of cities when we're talking about transition, focusing on mobility. The cities illustrated in green, the green dots, are cities with a high GDP per capita and a moderate car use levels. So in 1995s, in the late 90s, all of the cities in the green dot had car use levels that were close to 50%. So most of the cities are actually located in Europe, such as London, Paris, Vienna, Berlin. And what I'd like you to try and imagine now is that since 1995, actually, there's been some changes. And so you have to try and imagine that this green dot since 1995 have been moving towards the bottom right-hand corner of the diagram. So in other words, all of these cities' GDP per capita has continued to increase, whilst their car use levels has actually been gradually going down. So I'll give you an example. This is the modal share, the evolution of modal share in London. You can see in the year 2000, London had over 40% of car use in the city. Whilst in 2014, it went down. We got to 32%. And now the political ambition is to get down to 20% by 2040. And similar transitions have occurred in many cities in the green dots. Now, I'd like you to focus on the red dots on the screen. So we can see that the red dots are essentially cities that have a high GDP per capita and really high car use levels. So now let's guess which cities we're talking about. We're talking about mostly Northern American cities. Oh. Yep, Northern American cities and some cities in the Middle East. I'll give you an example. This is Houston in the USA. As you can see, essentially, most inhabitants use their private vehicle to move around the city. And in the academic jargon, we often refer to these cities as being locked in. So they're locked in because their urban structure was essentially designed to depend on car use. And they find it very difficult to reverse this trend. So typically there are cities with really high levels of congestion of traffic. As the city gets bigger, traffic increases, and it's very challenging to reverse that. Now, the cluster of city, as you can imagine, we're most interested in the context of the TSUM project, are the blue dots. Blue dots are cities that have a low GDP per capita and low car use levels, or motorbike use levels, but actually rapidly rising. Both of them are rapidly rising. So we estimate that our case study cities, Freetown and Maputo, are currently around there. So less than 20% of all trips are made by private vehicles. And this is the modal share in Maputo. That's from 2012. Vast majority of the people either walk or use minibuses. And in 2020, we estimate that now it's getting, the percentage of trips made by private vehicle is getting slowly but surely closer to the 20%. So the core question for us in the context of TSUM is, to what extent can these cities develop in a more sustainable way, avoiding the mistakes that many high-income cities have made, and ideally following a development pattern that is that would plateau, where car use levels would plateau and would remain at around 20%, which is the percentage that many cities are now aiming to get to. Now, this is particularly important because hundreds and actually probably thousands of cities across the global south are rapidly growing. So the urban population, the urban growth is very rapid, especially across Africa. And unless we address these issues related to how these cities will develop and the extent to which they will follow sustainable urban mobility development, we will not achieve several sustainable development goals. We will not achieve the climate agreements and other high-level goals. So this is absolutely critical and essential. Now, what have we been doing in the context of TSUM to try and explore these questions and these issues? The TSUM project was structured into, or is structured into, 4 key work packages. The first one was all about developing a conceptual framework and empirical evidence. And the second one was about assessing base conditions in our case study cities linked with mobility, accessibility, and land use. And the third work package aims to use the findings from work package 1 and 2 and initiate the development of vision pathways and implementation strategies in our 2 case study cities. And this is this work package and the processes we've been following and implementing in this work package that I'm going to highlight now. At the core of this work package were the design and development of participatory policy workshops. What were the objectives? So the aim of these workshops were to essentially foster evidence-based policymaking. And to do that, we, our local partners and different key partners across levels of governance got together. We created a steering committee where key decision makers got together, and we designed workshops that would aim at discussing and agreeing on a vision for the city, discussing and agreeing on possible urban trajectories and transitions, identifying relevant policy instruments to get to this vision, establishing a roadmap for the implementation of policy instruments, and identifying practical implementation constraints and opportunities to achieve the vision. So we organized 2 workshops in Freetown, one in December 2019, one in March 2020. 50 key stakeholders across sectors were involved: public, private sector, different disciplines, representatives of the public, transport users, key decision makers, etc., etc. And now I'm going to share with you some of the key findings from these workshops. One really interesting exercise we ran was about creating a vision for the city. So it was a discussion session we facilitated where we asked participants, what sort of city would you like to live in? Can we come up with a consensus? What sort of city would you like your children or grandchildren to live in? Or what kind of city would best accommodate a toddler, teenager, an older citizen, disabled person? And how would children get to school in this ideal city? Now, you might not be surprised to hear that actually it was relatively easy for all the participants to agree on what vision they would like to implement. And here is a highlight, a brief overview of some of the criteria that they agreed on. They want their city to be well planned and organized. They want their city to be healthy, to be green and sustainable, to be accessible and inclusive, to be prosperous, to be safe. This is very much aligned with the SDGs, and this is what people across all sorts of background and professions agreed that they want for their city. The second point we discussed with them was, okay, well, if we've decided on this vision, then what are the principles, the key principles, the guiding principles that could get us to this vision by supporting mobility and transport systems that are accessible to all, efficient, safe and green? The participants agreed on 7 key principles, including coordinating and controlling land use and integrating urban and transport planning, ensuring cross-sectoral collaboration and strengthening institutional and planning capacity, promoting high density and mixed land use development, prioritizing collective transport and active travel, technological innovation, generating revenue or increasing urban resilience. The third point we discussed with them was this question: is an increase in car use and avoiding making the mistakes high-income cities have made preventable in your city? And to what extent can your city actually leapfrog? To what extent can this transition, sustainable transition, is possible in your city? Now, to our surprise, the majority of the participants actually were hopeful or said it's definitely preventable. There was a lot of actually positivity, which was really nice actually to hear. And the 4 key points that they highlighted to get to this, well, to make sure the mistakes are not repeated in their city, are making sure we change people and policy mindsets, promote public transport, discourage car use through taxes, for example, and incentivize the use of other transport modes. The final point that I'm going to highlight before I finish is linked with the policy instruments. So participants came to a consensus about the vision they would like for the city. And the question we asked them were related to the policy instruments that could lead, that could get them to this vision, that could get them to leapfrog. So we suggested various policy instruments that seem to have been successful across cities, mostly in the global south, but we also asked participants to come up with ideas and suggestions of instruments that would be really suitable to their city. And the diagram that you can see basically illustrates or summarizes some of the key findings, where they highlighted that the policy instruments that should be prioritized, and policy instruments that are more or less, for example, prioritizing collective transport, mass transit or land value capture, were all amongst the list of most important and most urgent policy instruments to implement. So I'd love to tell you much more about the findings. We have so much more findings and more interesting results to share. And I'm going to stop now, but I'd like to invite you to connect with us via our website or our Twitter account so that you can get updates. And I really look forward to your feedback and comments. Thank you.
Thank you, Clemence, and thank you for sticking so strictly to the time. Very disciplined. Now, I would like to give the space for Lynn to show us her work in the context of Latin America, now having heard a bit about Africa and sort of a global perspective from James. So Lynn, please go ahead.
Thank you, Daniel. Can you see my screen?
Can you please put it in full screen mode?
Sure. Okay.
It's in presenter view.
Oh, it is? Okay. Okay.
Yes,
Is that better? Okay, great. All right. Good morning, everyone, or good afternoon, depending on where you're at. And thank you very much for the opportunity to present this ongoing work. This is a work in progress, looking at the role of shared mobility platforms, ride-hailing, microtransit, and other shared mobility on sustainable urban transportation with an eye toward social inclusion, poverty, and inequality in the region of Latin America. My co-authors are Daniel Oviedo, Orlando Sabogal, Felipe Bedoya, and Daniel Perez. So just a bit of background. TNC, Transport Network Companies, which is the technical term for ride-hailing, and more recently, microtransit systems have been making their way into emerging cities of Latin America over the past 5 years. I think now with COVID, obviously this has slowed down, but just before COVID, there was, in the years just leading up to that, there was a lot of debate in the region about the impact in cities of Uber and other ride-hailing companies, both in North American cities and in the global South, in terms of impacts on congestion, impacts on public transport ridership, impacts on vehicle ownership, and the extent to which TNCs and ride-hailing companies were substituting for public transport, in the sense of allowing people to not buy a vehicle, or if in turn it was increasing car ownership because of the access to lower cost vehicles, particularly in developing countries, where Uber or other TNC companies such as Didi and 99 Taxi give access to credit to buy new vehicles. Just a bit of background on how it ties into social inclusion, poverty, and inequality in the region is persistent in Latin American, in the Caribbean cities. Although there was a decline in poverty in the last 10 years due to a commodities boom in the region, more recently that trend has stagnated, and we still see 30% of the population in poverty and 10% in extreme poverty. There's a large trend in the last 40 to 50 years towards urbanization of cities, with 80 to 90% of the population in many Latin American countries living in urban areas, which has been driven by low-income populations migrating from rural areas in search of opportunities. But in combination with unplanned urban growth and sprawl, much of new development has been on the periphery in low density and very informal settlements. In turn, with the rise of income of the upper income groups, we've seen an increase in motorization. We've also seen an increase in motorcycle ownership. And this has put a strain on public transport systems, which oftentimes it relies heavily on tariff revenue. And so the very poor who depend on these services tend to have to ride in informal public transport systems, or in systems that are increasingly overcrowded or of low quality. Some background on some work that we've done prior to this work, evaluating the impacts of new investments in BRTs. We found very positive impacts in terms of access to employment, where people who live near the new BRT systems or metros, in the case of Lima, have actually seen an increase in the odds of having employment, particularly for women. And part of that might be the impact of increased security in public transport systems that are modernized and have cameras, but also the issue of time poverty that women experience oftentimes in developing countries, where having to take on more of the household-related work, they have less time, and so the time savings of these systems, we theorize, may have increased access to jobs. And in the context of new forms of mobility, I forgot to say that one of the findings that we found in these evaluations is that although it has impacted job access for many people, the very poor that live in the periphery have not benefited, particularly those who live in the feeder areas, which were designed to bring people to these systems. Those have seen very little to no impacts. And so one of the issues that we see is that in these low-income informal settlements in the periphery, large mass transit systems such as this BRT that you see in the picture are very difficult to provide. And so there's an issue with the first and last mile transportation to access mass transit. And so one of the key questions is to what extent shared mobility technology, ITS, and app-based mobility can increase access to mass transit and also increase access to jobs where a high-capacity mass transit may not be appropriate or may not be available. Also, there's an increasing interest in how microtransit, which is a form of sort of an Uber pool or an Uber bus type of model where the apps can be used to provide demand-responsive paratransit that's improved over informal minivans that we often see proliferating in many Latin American cities. And so some of the questions that we have here, it's a big agenda, and this is preliminary research that I'm going to present. We're looking at just some of the basic questions about what are the determinants of ride-hailing users? So who are they? What kinds of trips do they use them for? And we also are asking how are TNCs competing and or complementing with public transport systems? How and in what context? Next, we're looking at how ride-hailing and shared mobility can help with the first and last mile of service to transit. And last, we will be looking in the future at impacts on car ownership and motorization with two theories. On the one hand, you might see, as I mentioned, that people may not need to buy a car. So younger people who are just coming into the labor market, they may decide to forego car ownership because they have access to ride-hailing. On the other hand, people that may need access to a car for employment may buy a car so that they can become a driver. So there's a two-pronged hypothesis there. In the past, most studies on shared mobilities come from North America with emerging research in the global South. There's no real consensus on the impacts on public transport yet or on sustainability. We do know that highly educated and younger people tend to use TNCs and that urban form and the built environment matter. For example, where we have lots of public transport access, we see ride-hailing increasing because people tend to forego auto ownership. I won't go too much into the details of the modeling exercises, but we're starting out looking at two cities, and we will include Bogota as well as a third city. Right now we have a lot of work completed from Mexico City, Medellin, as well as Colombia, looking at medium and large size cities. We're using as data sources origin destination surveys from 2017. And in the case of Colombia, we're using a census, a survey of formal public transport systems over a 13-year period. Some of the outcomes that we're looking at to answer the research questions are the probability that someone will become a ride-hailing adopter in terms of the ride-hailing trips that they use over the week of the surveys that I mentioned. We're also looking at the intensity of usage. So what determines if someone is an occasional user, a medium user, or a high-intensity user. We're also looking at how passengers trade off trips in ride-hailing versus other modes and what influences those choices. And lastly, in the case of Colombia, we're looking at the impacts particularly on public transport ridership using what's called a staggered difference in difference model, taking advantage of the difference in timing of Uber and other TNCs into the markets of these cities. So some of the explanatory variables that we're looking at in terms of what we theorize to be predictors of ride-hailing usage include individual characteristics, household characteristics, mobility in terms of the type of, the extent to which households have vehicles in their household, the trip purposes that they tend to travel for, the urban and built environment in which they live, for example, the public transport availability. So I will just touch upon, I'm not sure how I'm doing on time, but I will touch upon each of the results that we have for each of the cities and for the case of Colombia. A bit of background for Mexico City. It's one of the most congested cities in the world. It's fast growing. It has, I think, doubled in population since 1980 with a population of 22 million people. High rates of congestion and urban sprawl. They have BRT systems and a metro system, but it's not nearly enough to meet the demand. So they have highly crowded metro systems, and they rely a lot on informal and minivans, which are referred to as jitneys here. TNCs account for 140,000 daily trips. It's still a small share of the total trips in 2017, but since ride-hailing is a rapidly changing phenomena, that may have increased in recent years, leading up to the COVID crisis. Here are some results of some of the modeling that we've done. This graph here presents the results of a logit model, which is looking at the probability that someone will use a ride-hailing mode as their trip in the week of the survey. And we see that similar to what what the literature says for North America, that highly educated, higher income people tend to use ride-hailing more so than lower educated or lower income groups, and that having a car in the household is actually decreases the probability that you will use a TNC. So it seems to be providing mobility for those who don't have car ownership. I think in the next iteration of this, we should probably look at how that varies by income. So to the extent to which, even though TNCs are used mostly by high income groups, to what extent maybe for lower income groups this could be a potential source of mobility. We also see that women tend to be more frequent users of TNCs. And one of the hypotheses that we have is that might be related to security concerns that women have in public transport, particularly in informal transport in Latin American cities, which is something that we will be exploring in future research this year. We also see that in contrast with other modes, TNCs are used mostly by highly educated groups who have a college degree or above, with I think it's nearly 60% of the trips in TNCs are by college educated persons. We also see that many of the trips in TNCs are at this point are for leisure, so they're not serving work trips or let's say basic trips that people would have for errands and so forth, but they're more for recreational. But one interesting result that we see in some of the modeling exercises is that healthcare trips are an important component of TNC trips. So I think that going forward, it would be interesting to see to what extent that is providing a mode of access to healthcare for low-income populations or vulnerable populations in cities where public transport might not be available. So in summary, we find in Mexico City that gender matters, that women are 35% more likely to use ride-hailing compared to men, and compared to using a jitney, which is an informal mode of transport, a metro, which is extremely crowded in Mexico City and has a lot of sexual harassment issues, BRTs and buses. I'm not sure if that was a signal for 5 minutes, but that women are much more likely to prefer a TNC. Adopters tend to be younger, in their early 20s to early 20s, basically. I will move on because I think I'm running out of time. In Medellin, we also see similar results, that it's a congested city, although not quite as intense in Mexico City. It's a very innovative city that's been doing a lot in terms of planning for access. They've implemented cable cars called the Metro Cable, which connects low-income populations to the center, which has been shown to have very positive impacts in some impact evaluations that have been published for citizen security and for employment access. Uber and other platform-based services are unregulated, but they are quite prevalent. There's a lot of iterations of Uber that I won't go into right now. We see that in contrast to Mexico City, which I didn't mention, we don't see Ubers or other TNCs being used to access public transport. Almost all trips made in a TNC in Mexico City are just door-to-door trips. But here we see in Medellin a very interesting trend. We should say that this survey in 2017 doesn't have a lot of TNC trips, so we're going to be complementing this with our own survey that we'll be implementing next month. But we see that 35% of all trips made in a TNC are to access public transport in Medellin. So that's interesting in the sense of answering one of our questions, that is, are TNCs being used to access public transport, or are they being used as a substitute? We also see that those who are using it to access public transport tend to be from the lower income groups. So these three charts here show socioeconomic status, 1 through 5, or 1 through 6 rather. 6 is the highest income and 1 is the lowest income group. And we see that those who access public transport with a ride-hailing mode tend to be in the lower income groups, if you look at the top right-hand panel. So this is some technical information. I have to look at my big screen to see this. But we see, again, as in the case of Mexico City, that being female increases the probability of using ride-hailing. The number of vehicles in the household also decreases that probability. And we see that weekday trips are more likely, and that the prevalence of public transport in terms of the density of bus stops decreases the likelihood of using ride-hailing. So we see that ride-hailing could be used as a substitute for public transport where public transport is scarcer or not available at certain times of day. We also see in the case, not here, but in Mexico City, that Ubers are used more at nighttime. Am I out of time?
Yes.
Okay.
You can have 1 more minute to close.
Okay, great. So, and I will just skip through this, but basically the takeaway for the case of Colombia is that we don't see a decrease in public transit ridership as impact of Uber entrance, although there's some suggestive evidence that there's a decline in public transport, but it's not statistically significant. So just this is a summary of the conclusions. I think going forward, what will be very interesting to see is the results of our surveys. We are implementing surveys in the cities of Bogota, Medellin, and Mexico City, so we can really dig deeper into our research questions, because all the surveys that we looked at were useful in the terms that they asked for whether or not a person took a TNC trip. The sample sizes were quite small, and that might be because of the limited prevalence of TNCs in 2017 compared to currently. We'll also be working with DD and working with the data that they'll provide us on their trips, and that hopefully will allow us to answer more in depth some of the questions that this research has brought up. And finally, we want to look at microtransit, looking at the idea of applying the apps to improve the informal public transport sector. Thank you very much.
Thanks, Lynn, and thank you to all our panelists for such exciting and diverse presentations. Just to kick off the conversation, as I see there are quite a few questions already in our Q&A, and our panelists have done their best to answer some of those. I think something that comes out of James's presentation, and you touch upon it at the end of your talk, is how do you see these different models and these different visions for the future to which cities in the Global South can transition, affecting the poor and the socially vulnerable? And I think there is quite a lot already in the questions that have been asked to you in relation to density, in relation to also informality and community responses. So I think it would be good to hear from you more about what role do you see the community responses and the informal livelihoods, the informal transport playing into these new models.
Me, or who was that addressed to? Sorry.
To James.
Oh, okay, great.
Yeah, thank you, Daniel, and thank you to all the attendees for the questions. I got sucked into just engaging with them, but they're really making me think. So apologies, I'm not coming up with any great answers, but they're really prompting some thoughts about how this lands in different places. I mean, we did quite a long research project on informal transit in Kampala, focusing on motorcycle taxis in particular. And we were trying to find out how much they were used, who used them, why they used them. And then we did a piece from the driver's side about what that looked like from their point of view, how busy they were, how the bikes fitted in to the urban landscape, how much money they made, the different kind of rental models they all experienced working with different companies or different landlords who owned the bikes. And it convinced me completely that in rapidly growing cities that are characterized by high levels of informal settlements, informal transit, paratransit has to be part of the solution. You know, everyone knows the principles that make public transport attractive. You know, there was a good question about how do we make public transport a choice rather than just something you have to do if you don't own a car. Well, just go to Sweden and go to any city or town there, and it's more pleasant. But it's hugely expensive. And certainly when you're looking at cities with tens of millions of people, you know, the only country in the world that's got near to implementing public transit rapidly is China. And those of you who've been to big Chinese cities, you know, forget Beijing, but Tianjin or Guangzhou or something, those systems are not great either. And they've thrown unlimited money at them. And that's just not going to happen in a lot of cities in different parts of the world that don't have enough money to build pavements, let alone mass transit systems. So informal transport has to be part of the solution. It absolutely blew my mind when motorcycle taxis were banned in Lagos earlier this year. Honestly, I could not believe it. Regulate them, sure. Safe Boda, which is a company originating in East Africa, who provide all passengers with helmets. All the drivers wear helmets. They have hair nets inside the helmets for anyone concerned about hygiene. All the drivers are trained in first aid, and they'll stop and assist any road accident, not just one they're in. And they've got a safety track record that is absolutely fact, and it's extremely good. And these bikes can get around the city. They don't take up much room. They're good for really big cities where you can't really walk over these huge distances. Our research in Kampala showed that even poorer people use this form of transport. This is absolutely not just for the more well-off and educated. And, you know, in the era of COVID, if you're on a motorbike, yes, you're close to the driver, but you're outside and you're not face to face. I mean, it's probably a lower risk than being in a taxi with someone. So I couldn't agree more. The people on the chat saying informal solutions have to be considered. Absolutely, absolutely. But the challenge is how you get transport planners in cities who've been educated, often in North America, into a global north model of buses and BRT. They have no idea how you go about engaging with these informal services. And to be fair, if you look at the mess a lot of cities in the north have made, I mean, look at London's relationship with Uber. They've hardly, engaged very well with these disruptive things here. So it's a big challenge for city authorities, but they need to sort their act.
Of points that James just mentioned. And the first one is, how do we challenge those models and those sort of remnants of the training that the people making decisions in Global South cities they have embedded in the back of their heads, basically. And for that, I would like to ask from Clemence and the experiences in the TISM workshops, how the different perspectives and these biases were challenged and integrated in the construction of a vision to where do we want to transition.
Yes, it was really a really fascinating process running these workshops, because the biases that you mentioned and the different ideas of what modernity is or what modernity should be did come up during the workshop. And what we had decided to do, the way we had decided to address this biases and views when we were designing the workshop with our local colleagues and some of the decision makers involved in the process, was to actually really remind participants that we're all in the room to try to achieve the vision that we all agreed. So we basically started by defining this vision, and once we had this vision and everybody agreed, there wasn't, as I mentioned, there wasn't really disagreements. People agreed that this is the vision they want. Then we basically said, well, based on the best available evidence, this is going to be the best way to get to the vision. So will building more highways contribute to your vision, or will getting rid of all your minibuses really contribute to the vision? And we basically facilitated discussions with this kind of almost like the vision as a lighthouse for all the participants in the room. And I think this should be for all cities and all people planning cities. This should be the first step, really. What is your vision? Once you have that, you draw on the best available evidence, and hopefully you get to a change in perspective.
Great, thanks, Clem. And I'm going to weave into the question about technologies and about TNCs for Lynn, because partly one of the tensions that we're seeing in Global South cities is that there are some visions, at least from some stakeholders, of a purely technology-based sort of smart city in the Global South, and these players like the Ubers and the other operators have a lot of leverage and a lot of influence on policy making. So how do we negotiate these tensions from your work on TNCs? Where do you see, Lynn, the potentials to leverage to some extent those spaces for negotiation? But also, how do we address the tension between regulating the traditional transport, which has been marked as informal, as unsafe, as bad, and then a similar paratransit, such as an Uberpool, which comes with a shiny app, and then everyone is in love with it. So how do you see this? You're mute.
I'm not sure that I fully understood the first half of the question, but so I'll start with the second half. I think that's the essence of the research that we want to do here, is to understand how can we link together this trend towards cities becoming more technology-based, and link that the new innovation frontier with the informal sector, which many times, even though we talk about technology, we talk about modernizing cities and modernizing public transport, the informal sector, the traditional public transport sector, continues to provide a bulk of the trips in many places. And I think that there's a lot of work to be done in the regulatory sphere in terms of rethinking transport finance. As we so-called modernize public transport systems and invest in mass transit, we need to think about how affordable that is for the bulk of the population, how it's financed. Right now, the model primarily is to finance that based upon tariff revenues, but often we see that that falls short in terms of the demand falls short, particularly in the first years, but the cost usually far exceed the operational costs, as well as the construction cost of those systems. And I think in the era of the transition from COVID, now we're seeing that overcrowding on public transport is not something that's sustainable. And under the current models of having public transport system be financially self-sustaining, I think that that model of having 5 to 6 persons per square meter on a bus is no longer feasible, I think, from now into the long foreseeable future. And I think we have to rethink the regulatory models that we have now, which are more centralized PPPs with 4 or 5 different actors running a bus sector, and now think of a more decentralized model, perhaps, where informal transit could be regulated through apps that in turn have a regulation for service quality standards, safety standards, mechanisms for reporting of crime or sexual harassment in them, and allow the planning side of that perhaps to be more from the bottom up rather than the top down of a technocratic viewpoint of trying to calculate the demand and having the most efficient in terms of cost savings system, but maybe from the bottom up of allowing users which are requesting rides via apps determine what the supply will be for them and what they want. In terms of also giving feedback with apps, there's a lot of possibilities of rating systems and providing more incentives through technology to provide high quality decentralized service.
Good. Karen, I wonder if you want to jump in with a couple of questions as well.
I only just have one really quick question, and that is in terms of trying to change the current trajectories of promised spending from the banks at the formal infrastructures. And Lynn, sort of how you seem to be already providing the sorts of research that shows that we have to reach, and Clemence, that we have to sort of stick with our traffic levels as they are within global south cities and or decrease them even further, and that we somehow have to come up with a much better mix of walkability, active travel provision. How are we going to influence the banks that are funding completely the reverse of those systems? How are we going to really influence the big politicians and the decision makers in cities to come up with this, to fulfill Clemence's vision and to influence the funders to fund Clemence's vision within sort of James's transitionary picture, I guess? It's a bit of a big question, but maybe one of you each could say one thing about how we think we can do the influencing through networks like Interlink.
Who would like to go first? Clem?
I'm happy to go first. I'm going to go first by sharing this with you, which is essentially the partners in the TSEM project. And as you can see, we've basically involved the World Bank, the French Development Agency, and UN Habitat. And this has been really the best, it's been one of the best ways to make sure that this happens, because they have been informed of what evidence we're generating. They have been involved in the governance and policy making and planning processes that we've generated, and they now are part of they're part of the process. So I would encourage anyone who is designing research projects or any other projects to involve international donor organizations from the start to make sure that they they basically implement what we talk about.
Thanks, Clemence. Who would like to say something now? James, yeah.
Yeah, I'd agree 100% with Clemence's point. People used to talk about the quadruple helix of innovation, which was companies, public organizations, charities, and communities and now they talk about the quintuple helix, which adds in financial organizations as well, because yeah, you need the people who've got the money to be on board with it. One other thing that came out of a proposal, I think it was one with Karen that we were developing ages ago, was talking to funding bodies, and there's a reason they like paying for things like highways and dams, and it's because they're big single object projects. As with everything to do with sustainability, what you come up with is 100 different small scale interventions that all have 100 different co-benefits, many of which pay off to different stakeholders over quite long timescales. And it's just harder to package that up as a single investment opportunity to be made with a set of clear benefits to a clear set of people that are going to generate clear kind of dollars at the end of it. So I think the challenge for us is how we, it's a challenge that's been facing environmental economists for years, but there are actually some far more intelligent financial instruments out there now that can collectivize risk, social impact bonds. There's all sorts of stuff out there. And again, it just plays into that thing that Clemence just said. You've got to have the finance people on board to tell you what they are and say, well, this is the kind of evidence we'd need. These are the kinds of ways you'd have to package up these interventions into big enough fundable schemes.
Great, thanks, James. Lynn, would you like to add something from within a financial organization?
Sure. Yes. Yes. I would say that just doing the work that we're doing and keep pushing the envelope in terms of evidence-based policy research is extremely important. Within the IDB, all of our projects need to go through a rigorous review process in which we need to show that there's evidence that the measures that we are financing will be effective and achieve the objectives of the countries in terms of development. And so I think that the more that we can provide evidence-based policy recommendations within those financial packages, I think the more effective we can be as a development bank. And I think that those large projects such as metros and BOTs are extremely important and can be very effective in terms of providing positive impacts. But I think now that what we're seeing is that we also need the complementary policies that go along with those. And I think at the end of the day, it's the local government's decision and sometimes the metropolitan area or the national government's decision. And I think that the more evidence that we can present that this will make their project more effective in terms of providing increased mobility and access to all populations and reduce poverty, the more likely that will occur. But it's a complex task. There's many different players, and we're just one player amongst many. I guess, we hope that our research has an impact, but I think as with any research, there's no one research that can answer all the questions. And I think that, that there's so many different people working in the space and providing evidence that corroborates, provides more of a vision towards where you want to go. And I think that absolutely what Clemence was saying about participatory planning is very key as well. I think that it's always important to include the actors that are the beneficiaries and include their opinion in this, which is something that we also try to do as a development bank, and it's part of one of our policies as well. But I think having both of those mechanisms at work is the way to go. And I think we're also, it's a challenge because technology is rapidly changing, so we have to constantly catching up with the new technology innovations and what kinds of policy responses we need to respond to those.
Great. So thank you, everyone. And I think this has been a very fruitful discussion, as all we have had so far. We have run out of time, unfortunately. So for those still with us, we will share the recording of this session in the Interlink website. And please follow us on our different social networks, on Interlink and Interlink Black in Twitter, and also on LinkedIn. And we'll see you in our next webinar series, which unfortunately I don't remember what's was the topic on health, on transport and health. So thank you everyone, and thank you again to all our panelists. I hope you have enjoyed the event. Bye.